So today, thank you guys for having me. Today, we're going to talk a little bit about training for health equity, but in a sort of a different way or more novel way in terms of reimagining design and delivery so that we can position agencies and individuals for action when it comes to health equity. So no conflicts to disclose, just objectives. I'm going to talk a little bit about theoretical frameworks that are applicable to equity training, and then outline components of an innovative program that we are designing to promote health equity and social justice in behavioral health specifically, but really in health broadly. So just really quick, what is behavioral health equity? So it's the right to access quality care for all populations. So that's the right to access quality mental health care or care for substance use, regardless of demographic characteristics, regardless of status, and regardless of any personal characteristic. When we don't have health equity, which is highlighted in the midst of this current pandemic, we have disparities. And we're already starting to get some glimpses of potential behavioral health disparities that are being exacerbated with the current pandemic. There were behavioral health disparities pre-existing COVID-19, and we're starting to get initial data on some of those disparities exacerbating. So I've shown this before on previous sessions with you all. I just wanted to kind of revisit this because when we think about health equity, we really are looking at a better dissemination or sort of distribution of resources at the societal level, and environmental level, and the community level before we can even really get to helping perpetuate or help sustain healthy individuals. So really looking at social determinants of health and those resources being distributed more equitably. The reason why is when we think about individual health, I think this graph really sort of, or this image really sort of captures it best. When we think about individual health, really there is a preponderance of factors that contribute to our health that are beyond our personal individual control. And so we really like to think of this more as it's not so much your genetic code, but really your zip code that often determines a lot of your health outcomes and your health status. So when we look at this individual, sort of how he's broken down, around 40% is those socioeconomic factors, so a lot of those social determinants of health. 10% is that physical environment, so still also social determinant of health. And then access to healthcare is about 20% of that, and the quality of the healthcare that you receive. So really, when you break this down, only 30% of an individual's health is really attributed to those health behaviors that in behavioral health we're often trying to enact some change, but it's change in context. It's 30% within the midst of the remaining factors that maybe are out of the individual's control. So when we think about health equity, these are some of the common challenges that you hear at the agency level, institution levels, and at the individual level. When it comes to how do we make progress in health equity. Here are some of the common challenges that we hear. That equity is a large-scale social problem, so where do we sort of fit in that mechanism? How can we enact change when we're just sort of a small cog in a larger problem or a larger system? That contributes to that limited role definition. So what is our role as a behavioral health agency? Or what is our role as an individual within a behavioral health agency? Agencies often report feeling like maybe they don't have enough training or guidance on how to make progress in terms of health equity. Like, where do I start? Feels like a really big problem, and not really knowing where to start or how to initiate strategy implementation and then sustain it. Sometimes we hear about lack of support and resources, so whether that's a top-down or just a bottom-up process, but maybe not feeling like there's maybe institutional support, which really needs to drive some of that change. Maybe not having resources, a lot of time demands, a lot of other demands on professional identity and professional responsibilities, and so where does health equity sort of fit? Lacking coordinated effort or coherent plans. So feeling like agencies may be able to implement a strategy, but not necessarily feeling like they understand how to do that in a way that is sustainable, or in a way that is coordinated, or is the foundation for a sort of coherent plan to kind of continually make progress. That gets into that one-time strategy implementation, where maybe we'll implement this one strategy, we'll make some progress in this one particular area, but now not knowing quite how to bridge off from that or how to build from that. And then we have some agencies or individuals who have had prior experience where their efforts have been ineffective, or they've tried something and it hasn't gone well. And so that can definitely, lead to feeling like maybe we're going to have some trouble making some progress in this space. And so trying to figure out maybe what the best way to go about that, but that sort of puts a stop, in terms of effort. So when we think about advancing health equity, I like to think about it within the Institute of Health Improvement Guidance, which is that equities progress through individual, institution, and community level processes. So that gets back to that role definition of what is sort of the role, or what part can you play in advancing health equity. It's definitely not going to be a siloed effort, but rather there's going to have to be effort or change at the individual level, at the institutional level, and then within community level processes as well. Because of that, we view inequities as with a systems lens or systems view, but we also look at strategies for mitigation of inequity through also that systems lens and systems view. So again, it's not going to be siloed efforts that will truly make progress in this space, but rather is going to be sort of a coherent and cohesive and collective effort. And then I just like this quote from the guidance, which is, advancing health equity urges to work both within our walls and dismantling the institutional racism, implicit biases that hold us back. And it encourages us to look beyond our walls, creating and nurturing partnerships in our communities that can make an impact on all the social determinants of health. So it's both that internal and that external lens, very similar to sort of cultural competence in general, where we look at our own biases or look what we're bringing into the system ourselves, but then also looking beyond that as well. So when we think about theoretical frameworks when it comes to equity, experiential learning, what we do know is that sitting in a training and digesting information is helpful, but really can be limited in terms of affecting change. So we want to try and build in experience-based learning opportunities into any kind of equity training. So whether that's involving field study or guided discovery options, those would be ways of kind of creating that experiential learning opportunity. Sociocultural learning, we know that learning is largely a social process. So we really do advocate for sort of cohort-based learning when it comes to equity work, so that folks aren't doing them again in silos or don't feel like they're sort of trying to target this or come at this on their own, but rather people do best when they're learning in a community, and you can learn about different efforts that different agencies or different entities are sort of involved in, and that might be helpful in terms of stimulating learning or progress as well. So just again, revisiting this, so we're going to be targeting sort of the lower levels here. And then for another framework that we're trying to implement is structural competency. So this is a newer framework in medicine, but certainly one that I think really fits well in the equity framework, and one that I think is gaining more traction. But it's basically about bridging structural and social determinants of health and clinical interventions. So for the purposes of advocating for really sort of structural interventions that will actually both address the individual in terms of their health, but then also understanding that that individual exists within a larger system, a larger community, and a larger society. And so those interventions are not just targeted the individual, but rather engage the provider or the entity in looking at interventions that target the individual, but the system as a whole. So looking at systemic change as well. And then social justice is designing and continuing evaluating agencies as resources that ensure equal opportunity and equal access for everyone, particularly our most vulnerable populations. And by doing so, we prepare individuals and agencies to create space where shifts in beliefs and practices can actually occur. So that's sort of the big component of training when it comes to social justice, is really preparing agencies and individuals to be able to make those changes and do it in a safe way where folks can feel like their advocacy and their efforts are done in a supportive environment. So this is a draft of basically a framework for a program that we're working on in terms of design and development. Equity is in the middle. And again, to go with that institute guidance, we target individual training, we target agency strategic planning. So how do you build an equity lens into your strategic planning? And then also agency community impact. So again, we're targeting those three levels: individual, agency, and community level processes. The three theoretical frameworks on your left in the graph or in the image, and just incorporates or just shows what theoretical frameworks we're sort of operating from. So when we break this down, individual trainings for entities would be things like systems of oppression, disparities in behavioral health equity, cultural elements, unconscious bias, class standards, talking about the cultural competency curriculum or continuum. Sorry, my phone thought I was saying something. But then the key here is also change leadership. So we're also preparing individuals to be able to develop leadership and develop the ability to enact change at their institution or their agency through this change leadership component as well. So again, these are sort of the individual targets of the program. When we talk about strategic planning, it's training and assessment, problem identification within your agency. Where are your gaps in terms of serving vulnerable populations? Where are your gaps in terms of ensuring equal access to quality care? Coaching folks through strategy selection and implementation, which involves quality and process improvement or training in that. How do you measure success, or how do you measure progress? And then how do you plan for sustainability? How do you then ensure that some of these strategies, if they need to be changed because of outcomes, can continue, you can make those changes and continue. In terms of community impact, it would be training in terms of leveraging individuals' expertise and agencies' expertise, and how do you build those community partnerships? So really focusing on training in terms of community building and collective impact. Some of this would be done, through that experiential piece, but then also some of it will be done just through sort of didactic and coaching. So how this works. So right now it's currently in design, but our thoughts on participants are that agencies or institutions across Ohio can be eligible to participate in this sort of cohort learning opportunity or training opportunity. We would request that 2 to 3 members of the agency be required to attend all sessions. That might include providers who are equity champions at their institution, but we'd also like to include as one of the 3 possible team members and someone in a managerial or leadership position to really drive some of this change as well. Delivery format. So we had originally thought of this before the pandemic, and then now we're sort of moving towards how do we recreate this or redesign this within the context of social distancing and things like that. So instead of a monthly training, rather be broken down into a weekly 90-minute training 3 times a month. But then every month you would also get a 90-minute coaching call. And so we would have an ongoing coaching team that sort of helps agencies or individuals or teams sort of work through strategies that they're implementing, their strategy selection. So with every sort of training every month, they would also receive coaching on those specific skills that we're working on. In terms of deliverables, we sort of designed it that entities would provide equity and cultural competence pre and post assessment. So at least we know where they're starting and then where they sort of end up at the end of the program. That they would have a draft behavioral health equity strategic plan, so a very specific strategic plan just related to equity as sort of their end product. And that sort of lays the groundwork for them moving forward, but they have that plan in place by the end of the time. And then they also report on progress on selected aims or objectives. But obviously over the course of the training, these would sort of be the deliverables or the end products that we're hoping to achieve. Other iterations, we're also designing a trainee program. So I'm in charge of the trainee program, but basically it's sort of the same conceptualization or framework for trainees in psychology or in medicine as well. But my area is pediatric psychology, so we're focusing on psychology right now. But training future leaders in health equity and social justice. So we were trying to develop or devise a minor or emphasis that our trainees could pursue. And we redesigned the experiential learning and the deliverables to be consistent with more of a trainee perspective and trainee product. So that would maybe involve a social justice learning, service learning opportunity, preparing policy briefs, things like that, that they would do with me. So there's other iterations of this that we're trying to develop and are under development right now. So I just wanted to leave my contact information. If you're interested in learning more about this program that we're designing, we're aiming for implementation somewhere in 2021. So probably fall application or sort of advertisement of the program, partnering with some of our SAMHSA transfer technology networks to offer it. So we're refining it. I welcome any feedback if people are interested, have questions. You know, it's not in its final form. So I also wanted to use today as sort of an opportunity to share with you all sort of what we're working on, but then also give you guys the opportunity to have feedback that could help us, you know, reframe or redesign some aspects of the program. But our goal and objective is just to try and help advance health equity work, especially now that in the midst of the pandemic. I think we've significantly highlighted the disparate inequities and the persistent inequities, and what can we do moving forward to really address them and get people the training that they need to be able to feel confident in doing this work. So that's it.